love running. I love running. If you have a look at many of the shoes that are on the running shoe wall for running and walking in the store, you'll notice that from the ball of the foot distally, the industry standard is approximately 15 to 20 degrees of extension, also known as dorsiflexion. The long-term negative of this is that these muscles and these tendons will then learn that contracted position, and they will stay like that even when the individual no longer has that footwear on. The primary condition this is most helpful for is hammer-toe deformity, where if these extensor tendons become too tight, the flexor tendon on the bottom of the toe will begin to pull the toes back into a crooked hammer-toe configuration. The plantar structures will be under tension if these extensor structures are contracted. So for plantar fasciitis, plantar fasciosis, for plantar fibromatosis, for capsulitis, metatarsalgia, neuroma, all of these conditions will be benefited by gaining greater flexibility in the long extensor tendons, which reapproximates the normal submetatarsal fat pad back in under the metatarsal bones. The way that this stretch is accomplished is by pulling the toes down into the direction of flexion, also known as plantar flexion. To do this stretch properly, you'll notice the knuckles on the top of the foot will be prominent. Many times this can be augmented with gentle pressure into the metatarsal arch with the contralateral thumb. This stretch can be held for 20 to 30 seconds, at which point many folks will have some gentle cramping in the arch, which is an indication that the arch muscles are attempting to get stronger. This exercise should be done in progressive increments until greater flexibility is achieved to the point where there's no longer dramatic extensor contracture. This same type of a stretch can also be accomplished just by putting your foot on the floor and bending the toes backwards. This stretch can simultaneously be done individually by bringing the foot into the lap and pulling down with the opposite hand. And once again, this is called the toe extensor stretch.